Okay, here's the other patient's chart. I'm going for my consultation now.
Excuse me?
I'm first. I'm first for surgery, I'm first for the consultation.
And you're serious?
Yeah, I'm serious. You have to wait.
Sue and I worked together and decided to have surgery on the same day.
To recover together.
I've had several plastic surgeries in the past. Do you have all day? My upper lid, a breast augmentation, my nose a couple times, a little bit of liposuction.
I have had plastic surgery on my breast and some liposuction. I'm going to have upper and lower eyelid surgery to have a more rested look.
Now I just like to fix the last little thing that bothers me, which is my chest. I'm trying to lose weight and I feel like my breasts are too large and make me look heavier.
Come on in. Join the party.
Wow.
We should have an office meeting. We've never had all four of us in the same room before.
Our first office meeting in 4 years now.
Yeah, basically. I think it would be safe to compare the office to a family.
They asked me the other day if I hadn't worked in plastic surgery, do I think I would have done this kind of treatment?
They're in a business where you need to look absolutely good all the time. I think it's part of the job, wouldn't you say so?
Everywhere you turn, something's coming up. Beauty, 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 beauty. Stay young, stay fit, stay this, stay that, you know. Look at us. Maybe we're caught up in it and we don't even realize we are. Why do we do this? Are you ready?
Yep.
Joy and Sue are both going to have their annual cosmetic surgical procedure. We've had to limit them to just one operation per year because it interferes too much with the flow of the office.
Good morning.
Yeah, I mean, if you do it above the hairline and you cut skin off, you're going to end up with a scar at the hairline anyway.
Hi, Harry.
How are you?
Well, I wasn't getting nervous till you two walked in.
What are we going to do?
Right now on the lower eyelids, he's made a small incision right beneath the eyelashes. And through that incision, we elevate the skin, dissect it off the underlying structures. And sometimes we remove a little bit of the fat tissue that's causing bags in the lower eyelids. Joy is giving Dr. Monty advice. Joy's been in this field since Dr. Monty was just a wee tyke. I don't want to embarrass you, Dr. Monty, but Joy's been in the operating room since you were in the 3rd grade. Right, Joy?
I asked her to bring me a pacifier earlier.
But I do want to help with the temporal brow lift. And I have an idea about what I want to do on her upper lid. Dr. Monty did a very nice job. That looks great. Very good. Gosh, Joy could actually...
You want me to scrub?
Well, you could help me with this while Aurora helps him with that.
Okay. I haven't been in the OR for a long time, so it's not the typical for me because I haven't been there for years.
Joy, I don't know where you're going to fit in here. Maybe you may have to sit on my shoulders.
I don't know who would like that more.
You know, there's something special, I think, about operating with a colleague anytime. It really adds an extra dimension to the surgery. It gives us an opportunity to give and take, to share ideas, and we did that. This is going to pull it up.
That looks nice. That's
really going to pull it up.
Yeah.
Can I do what do the other side?
Sure, I guess.
I really got it. There's too much blood.
Perfect.
We're almost done, and she's doing great.
He said that he's just finishing up and it shouldn't be much longer.
Okay.
Okay?
Okay, good.
Thank you.
You okay, Sue? Dr. Handel, Dr. Monty did beautiful surgery. You did real well. Sue, are you having any pain?
No.
Beautiful. Are you having any nausea?
No.
Are you having any regrets? No. She didn't say no to that one. That concerns me. Yeah, of course you're tired. Well, everything went fine. I've done a lot of surgery on them over the years. I think it's time to give somebody else a crack. Won't be the last surgery they ever have, that's for sure.
Yeah. Okay, someone has to take a picture of my chest. Joy, you look fabulous. Looks really good. You might be a little surprised. You look a lot smaller. There were some hormonal changes that happened during the surgery also.
That's a guy.
Oh, I'm sorry. Wrong operating room.
Do you have a headache? Yeah, a little bit.
Looking at your head gives me a headache.
They have to work on Monday.
You both ready to go home?
Yeah.
They're going to be the most bruised, battered employees that ever came to work.
Slide on down.
If they're not able to do things, I guess we'll just put them out in the waiting room and pretend that they're post-op patients and make people feel at home.
Speedy recovery.
Thank you.
But remember this area? This looks a lot better.
Better,
You
yes.
know,
Yes. Yeah, I was having a hard time getting it into a nice contour like that. Sue has a very realistic understanding of what can and can't be accomplished. She understands that there's going to be some inconveniences afterwards, bruising and swelling and discomfort. She tolerates that all very well because she's so well informed about it.
We're just lucky to have staff that we can experiment on like we do. It's just an amazing advantage that we have over our competition.
Both of them obviously are very sophisticated consumers of cosmetic surgery. If I am hurting you, let me know.
No, you're not hurting.
Are you sure?
It's a little bit.
Sue did have some little rubber drains that we had put into her brow lift incisions, so we had to remove those. There you go.
Okay, there's one out.
They slip out pretty easily.
Did you just put one in on this side?
It looks like it. The purpose of the drains is to just allow any fluid to escape so the fluid doesn't build up underneath the skin.
Very good.
So tomorrow morning I can wash my hair.
Or afternoon.
She's coming to work.
I'll wash your hair for you. You wait. I'll be your shampoo boy.
You're in surgery tomorrow, liar.
Just try to avoid that area. Just be careful.
Yeah, everything looks perfect here, Sue. Just a little bruising down here. I see you got a little makeup on. Sue had some bruising after her surgery. She has kind of fair skin, so that's kind of to be expected. Yeah, that looks great.
I can't wait till it all gets there.
I'd really like to take a look at both of you guys. I mean, I'm assuming you're both happy.
Yes.
I haven't got any nasty messages on my voicemail.
You didn't get my letter?
Yeah, the letter from your lawyer. Wow, that's unbelievable. Who's your doctor? No, I mean, those are really good scars. See, that just goes to show that it's better to be lucky than to be good. We're lucky she got a good result because, you know, that's really excellent.
I have no regrets whatsoever about my choice to have this surgery. I had full confidence in Dr. Handel and Dr. Mani.
When our own staff, you know, is willing to go under the knife, that's a real endorsement.
Yeah.
You can't beat that.
You should hear my shoulder. Most people don't know exactly what you had done. They just know something looks different about you. Right now, when I look in the mirror, I have more of an open eyelid, which I didn't expect. I guess I'm so used to the skin lying on my lashes that I never thought it could be as it is now. I seem a more rested individual, especially the lower lids. Oh my gosh. To me, that's a big difference. I want a different look, I suppose, than most people. I want to have some improvement, but I don't want to look plastic. Here, we can do that triathlon class, run, walk, cycle, swim. I feel wonderful about my choice, and the results have exceeded my expectation. On the inside, I don't think I've changed at all. I'm the same old Sue.